related to obstructive sleep apnea. The patient can present with this headache also. Okay, if the case is acromegaly, you have to ask about vision problem also. There could be some visual problem. Okay, then the other differential diagnosis you have to rule out like this, and then you proceed to find out, like in this case, we found that the patient is having the weight gain over the tummy area and over the back area. And then we have to ask, do you have any stria or stretch mark? Yes, she said, yes, it is positive on my tummy area. And then there are associated symptoms, as we mentioned. So in this case, we have to ask about the mood of the patient. How is your mood? So she was telling that I have low mood and I get agitated soon. Okay, then the complication related to this case, we have to ask the patient about muscle weakness. So usually if it is Cushing syndrome or Cushing disease, the patient will be having like uh, muscular weakness, also proximal myopathy features. So you can ask the indirect question that will indicate you, yes, the proximal myopathy is present or no. So we can ask the patient, do you have any difficulty in standing from sitting position? If there is proximal myopathy, patient will say, yeah. Okay. And then the patient can, you can ask about the patient overhead activities like, do you feel any difficulty in combing of the hairs or while doing the shampoo? So if it is there in the proximal muscles of the arm, the patient will say, yeah. So this will indicate the patient is having proximal myopathy. Then the other complication with Cushing syndrome, we have to ask the patient, do you have any abnormal hair growth? So here in this patient, there is hirsutism present. So we have to ask this. And then we have to ask about the acne problem. So she is having acne problem also. So this is all about the history. Then we can proceed to the past medical history. In the past medical history, you can also divide into past surgical history. But here in this patient, the patient is diabetic for last 4 years and she is hypertensive for last 3 years. Okay, and when you are asking about the diabetes and hypertension, then you have to ask about the control of the diabetes and control of the high blood pressure in your history. So in this patient, the diabetes was controlled in initial years, but for last 1 year, this diabetes is not being controlled. So you can ask the patient, did you check your 3-month blood sugar test, that is HbA1c? She said yes. I checked and it was, so you can ask how much it was. So it was 9. Similarly, then you have to ask the medication history, what medication you are taking for the diabetes. So she was taking metformin and sitagliptin. Are you adherent to your medications? Are you taking the medicines regularly? She will say yeah or no. So she was taking the medicine regularly. Even then the HbA1c is increasing and the blood sugar is not controlled. Okay, and then she already told that regarding the diabetes, if you are asking the history of diabetes, you have to focus like D. So diabetes, this is my mnemonic. So D for diabetes control, the drugs, what medication you are taking. The other D is, are you doing daily exercise or no? Then the other D is your diary of blood sugar. So do you manage your diary for blood sugar or no? So if you remember for diabetes D4 or D5, you will not forget the question related to diabetes control. Then we will proceed to the hypertension. How is the blood pressure? So she told the blood pressure is recently uncontrolled and she was taking valsartan 160 milligram OD. Okay. So did you visit your doctor, to your GP in the recent past? She said, yes, I visited there and he advised me to start insulin now, but I delayed and I told, okay, let me try my daily activities and we'll see. Okay, so in the drug history, we have to rule out pseudo-Cushing's. So pseudo-Cushing's, we have to ask about the patient, any stresses, alcohol intake, the depression. Okay, and then in the drug history, we have to ask, do you take steroid tablets for any reason or no? So this will complete our drug history, and then we will proceed to the family history. Any long-standing disease running in the family. So patient will mention whatever the family history is there or no. Some cases we have to ask like
Not coming.
sorry, can you hear me?
Yeah, it's now okay.
It was some problem before.
Yeah, it was not coming in between. Voice was not coming.
Okay, what was last my note? What I was talking last?
Drug history you are telling about.
Okay, so for the drug history, I will repeat now. So we have to take the detailed history of the medication, what medication patient is taking, and any recent changes in the medication. Okay, and then the counter medication patient is taking or no. So these are the different questions that we have to ask. Any recent changes also, any side effects noted in the if you are taking the medicines or no. Then from the drug history, we will proceed to the family history. In the family history, we have to see what the scenario is. If the scenario is like this scenario, so it is enough to ask like any long-standing disease running in the family. So in this patient, there was mother was having the diabetes and ischemic heart disease, and father is a known case of hypertension. And there was other than this, there was no significant thing. Okay. As it is the case based family history, sometime it is if it is tumor related case, we have to ask specifically about the tumorous history in the family. Or if it is something like inherited disorder, then we have to ask any inherited disorder running in the family or no. Then we will move to the social history. In the social history, okay, in social history, my mnemonic is Sajid, Sajid. As for smoking, do you smoke? So she said, yes, I'm smoking 3 to 4 cigarettes per day for last 5 years. So here we have to advise her to stop smoking, and I will uh, help you to send you to smoke cessation clinic. Okay. And alcohol intake is there or no? So she is taking the alcohol, but within the recommended limit. Job of the patient, what she is doing. So this lady is housewife. Then again, the next is I. I is impact of this problem to your daily activities. So she is telling, yes, it is affecting badly to my uh, routine life. I'm feeling like I'm gaining weight and I'm feeling embarrassed. Then the driving. Yes, she's driving, but here there is no issue related to the driving. So she can continue the driving. In some cases, we will see that the driving patient should stop the driving. So in social history like this, S for smoking, A for alcohol intake, J for job, and I for impact on the job or the daily activities of the patient, and D for driving. So this will complete our history situation, and then we have to do the review of systems by asking from head to toe the systems. So not to miss anything in the history. Is it clear to everyone, the history taking?
Yes, it's okay.
Thank you. So from here now, we should proceed to ask the patient what is your concern. Okay, so the patient will ask two or three concern mostly, not more than three. Usually two concern, one or two concern they used to ask. So here the patient is asking what is going on with me, and despite of my balanced diet and daily activities, I change the lifestyle. I'm not able to decrease my body weight. So here we have to address the concern that I have to do some test for you, and after getting the results of these tests, I will update you. There are different possibilities. You can inform her. This could be Cushing syndrome, as the features are going in favor of Cushing syndrome, so it is clear. So give the you can give the differential diagnosis. So usually we have to give three differential diagnoses, and examiners will also expecting at least 3 to 4 differential diagnoses. So here in this patient, if I address the concern of the patient, I will say that uh, the possibility is you have the problem in your glands. It's a medical condition in which the gland is overactive, located at the upper pole of the kidney. So it is overactive. Or if it is Cushing disease, then it will be related to pituitary gland also. So we have to just address the concern briefly, and then we have to inform the patient that I will examine you now, and then we will discuss at the end again. Okay, so taking the permission for examination, and then you will start your examination. So in this patient, in most of the patient, if you, because now the time is like you have sometimes 3 to 4 minutes or 5 minutes to examine the patient. So if you examine the patient systemically, you will not miss anything. So first, the facial appearance of the patient, how the patient looks, and then you can start from the hands of the patient. Hands give you a lot of information. Then from the hands, you can proceed to the uh, elbow area, and then you can ask, I would like to check the blood pressure, although the blood pressure is mentioned, but you have to mention the examiner that I would like to check the blood pressure. And then proximal myopathy, you have to check by asking the patient that just raise your shoulders up, and one shoulder, if you move up and down, if it is proximal myopathy, there will be weakness after some time. Or if you will press it down, the patient will not be able to raise the arms up. Then you will see the face of the patient. So in this patient, there is hirsutism and there is acne problem also. And there are no features in the eyes in this patient. There is no problem in the visual acuity or the visual field of the patient. You can check these. And then you can see the lateral eyebrows, like in hypothyroidism, you can see sometimes there is loss of lateral eyebrows. Okay, so there is then the oral cavity you can examine, and then the neck area to rule out any thyroid problem, and then the chest area you can do the auscultation briefly you can do the auscultation of the lungs, and you can do the auscultation of the cardiac area. Then the distribution of the body weight in this patient is over the upper back area, so you will see that, and then you will see the acanthosis nigrans also. And then the tummy area, you will go there, there will be stretch marks over there. So these stretch marks also indicating that the patient is having Cushing syndrome. So similarly, you can ask the patient when you go to the thigh, can you stand up from the sitting position or not? So and then the pedal edema is there or no? So this will conclude our examination. And then after completing the examination, you can explain to the patient that uh, from examination point of view also, you have features like going in favor of Cushing syndrome. So I will do the investigation for you, and after getting the result, we will have another meeting with you. Is this all right? She will say, yes, it is all right. So this will conclude your 15 minutes interaction with the patient. Okay. And then the examiners will be two examiners. One will be the observer, and the second will be taking the viva for you for 5 minutes. So here you will examiners will definitely ask you, okay, what is your findings? So you will tell the positive findings present in this patient, and then he will ask you your differential diagnosis. Okay, and then from there he will ask you the investigation, how you will do the investigation for this patient. So in this patient, or for any patient, you can divide the investigation into baseline investigation and the specific investigations. So baseline investigation, you can say the complete blood cell count. I will do the kidney function test. I will do the electrolytes. Okay, and whatever the investigation you are